with the given time, I will try to run through the therapeutic benefits of metformin with evidence and its place in clinical practice. So, in evidence-based medicine, our management of any disease, including diabetes, is guided by guidelines. So, this is the American Diabetes Association guidelines, which is commonly used for management of diabetes, even in Sri Lanka. So, if you look at the 2021 guidelines, up until 2021, metformin was placed in the place of first-line therapy with the lifestyle modification in management of type 2 diabetes. Why was that? So we know even though we are shifting the diabetes management from glucocentric approach to towards cardiorenal approach, we can't forget that the key in management of type 2 diabetes is the intensive glycemic control. Whatever we said and done, and what is done, if we do not achieve glycemic control, we cannot prevent micro and macrovascular complications. So the metformin is old and traditional, so the evidence is also old, probably 2-3 decades old. So the UK PDS study published in 1998 showed intensive glycemic control could reduce microvascular complications. 1% reduction in HbA1c could reduce 37% of microvascular complications. So for that, to achieve glycemic control, there are different pharmacotherapies available in diabetes to attack different mechanisms of action. So one of the major mechanisms, pathogenic mechanisms behind type 2 diabetes is the insulin resistance. So metformin is the key medication which attack that mechanism, the insulin resistance. So and also the efficacy of metformin in glycemic control. We know insulin is the most efficacious medication in achieving glycemic control. Then comes the sulfonylurea, metformin, 5-glitazone. So we can't forget that metformin is a very good efficacious medication in achieving glycemic control. So in addition to that, in UK PDS, it was shown that in long term, the achieving good intensive glycemic control could reduce macrovascular complications as well, with the metabolic memory and legacy effect. And also, so the metformin has shown its cardiovascular benefits. So this is the first study which showed the UK PDS in its metformin arm, where there was only 342 patients. So this cohort showed reduction in the cardiovascular events and cardiovascular deaths when compared to the conventional arm and sulfonylurea insulin arm in the intensive control group. So this was the major evidence which led to get the metformin into the first-line therapy as the first-line therapy in management guidelines. So not only that, this recently published meta-analysis published in 2019 also proved the same results which was shown in UK PDS 2 decades ago. This also showed that the cardiovascular risk reduction in cardiovascular mortality and events compared to the no drug group and sulfonylurea arms. And there are many mechanisms that has been proposed as possible underlying mechanisms of cardiovascular benefits in metformin. For example, lowering blood glucose, reducing inflammation, endothelial protection, and reducing leukocyte adhesion to the endothelium, etc. So this has been studied in many old studies. So while things were like that, then we know over last decade, the new drugs came up in the list, the SGLT2 inhibitors, a GLP-1 agonist, and with the CV outcome study results, they showed that these drugs are very much effective in cardiorenal protection. So then in most of these studies, these drugs were added to metformin, and then people thought whether it is a combination effect of metformin and these drugs. And then they did this meta-analysis to see the MACE reduction with novel anti-diabetic agents in metformin-naive type 2 diabetes patients. So they took the patients who were treated with those new medications without metformin from the landmark trials including Canvas, Emparage, Vertis, Excel, and Harmony. And those cohorts also showed significant MACE reduction without metformin. So then that was published in 2021. That was one of the major evidence that led to change the guidelines. And then if you look at the 2022 guidelines, they have pushed metformin a little bit down, saying that the press line should be selected based on their cardiovascular and renal risk. And press line, but they say press line probably include metformin and lifestyle modifications. And then this year, so that has been also removed from the ADA guideline. Now you can see metformin somewhere there for the, if you look at the algorithm. So when we are choosing the press line, they say, look, whether the patient is having atherosclerotic cardiovascular risk or renal risk, and based on that, select the press line. And for if they don't have that, for the glycemic control, go for metformin and other medications. So while everything is like that, let's see what's the prescription pattern of anti-diabetic drugs globally and locally. So this is the top 200 drugs used in USA in 2020. The metformin is the third most used drug in USA, but this was before the change in guidelines. We don't have the time to come will tell how the prescription patterns change after that. And this is another study from Austria, studied from 2012 to 2018, that shows that the SGLT2 use has gone up, sulfonylurea use has gone down, but still metformin remains at the top. This is again before this guideline change, and this is a small study I found in a family medicine journal from India, so probably from the primary care. This was published in 2021. They have been using the sulfonylurea and metformin mostly. So this is the case in Sri Lanka as well, and I was surrounded by endocrinologists today and yesterday. I did a quick survey and asked from few of them, what is the mostly prescribed anti-diabetic medication in your practice? So the answer was metformin. So I think whatever the Americans say, still we can't push down our metformin because of obvious reasons. And other than this, we know the metformin is weight neutral, and when compared to insulin and sulfonylurea, it shows that benefit. And also, if you look at the cost, the metformin is freely available in the government sector in Sri Lanka and in most South Asian countries, and it is one of the cheapest medications available. And if you talk to your patients, still there is a myth we can't remove from our patients' minds that metformin can harm the kidneys. So Kahandava talked about the mechanism of metformin-associated lactic acidosis, which is a very, very rare side effect. And this Cochrane review published in 2011 showed that the metformin-associated lactic acidosis is a very rare side effect of metformin, and it reported no cases of fatal or non-fatal lactic acidosis in 70,490 patient years of metformin use. So after that, KDIGO guidelines took down their EGFR cutoff of metformin use to 30 milliliters per minute. And this is one of the meta-analysis published in 2020, which shows even metformin usage in advanced kidney disease patients, especially those with CKD3B, decrease the risk of all-cause mortality and incident of end-stage renal failure. Additionally, metformin did not increase the risk of lactic acidosis. And also, this has been has been with us, the metformin, for several decades. So it has been used in special groups of diabetic populations, so especially pregnancy. So insulin is the preferred medication in pregnancy, but out of the oral medication, most of the guidelines recommend only metformin to be used in pregnancy. So recently, because of, you all know the MIG-TOFU data published in 2019, which showed that after 9 years follow-up in the Auckland cohort of MIG-TOFU, a study showed that the metformin-used babies were larger. Because of that, there was a concern, so they do not encourage metformin use, but it is not contraindicated. But still, American College of Obstetrician 2023 guidance also allows to use metformin in pregnancy. So this is the evidence I told you about. So other than in pregnancy, since it is safely used in pregnancy, so we know very safely metformin was used in pediatric population from very younger age. So that is one of the only drugs, oral medications which was available for pediatric population until recently, until other newer medications were approved to be used. So other than being anti-diabetic medication, metformin has shown many other benefits, many other the indications to be used. As Dr. Kahandava said, it has been used as an anti-aging medication. It has been tried to treat neurodegenerative diseases, cancer, and obviously the polycystic ovarian syndrome is one of the major indications for metformin use. And even in the history, if you looked at Kahandava's first 2 slides, it showed that it was initially used in influenza like that. It has been tested as an antibiotic, antiparasitic medication, and even studied in COVID-19 as a medication. So some people have thought it could be named as the aspirin of 21st century. So in summary, so it is, as the topic said, is traditional metformin has proven therapeutic benefits, and also it's weight neutral, and it has been safe and with us for more than 2-3 decades, and it is freely available and cheap. So even though the guidelines push it down, we might not be able to do that for at least few more years until the newer drugs become cheaper. And even if it is first line or second line, it will be a very important drug, anti-diabetic medication, because of its efficacy, glucose lowering ability, and the attack in the main mechanism of diabetes, that insulin resistance, being weight neutral and safe. Thank you.